Hello, this NUR1000 recording will go over positive and negative event queries, imposter syndrome, and two specific NCLEX item types, select N and grouping. So you will have a separate recording that goes over imposter syndrome. So I'll let that recording get into what it is and how you can deal with it. One of your assignments, your discussion board posting, will be about imposter syndrome and your personal experiences with it. Please know that you do not need to share anything that you don't feel comfortable sharing. So if you have something personal that you don't want to share, please don't share it. You can use examples from anonymous friends and family to answer the question. But the big takeaway is that most people have experienced imposter syndrome somewhere in their life where they feel like they kind of are fraudulent or don't really belong where they're at or don't deserve to be where they're at. So again, it can be kind of personal, so don't share things you don't want to. Positive event query questions are the types of questions that you see most commonly on any exam in terms of multiple choice questions. So positive being you're trying to find the right thing or the right answer. Your textbook describes it as it asks you to make a decision and select an option that is accurate or correct with regard to the data presented in the question. So it's just a normal correct answer question. So like which of the following is an orange, and you have pictures of a banana, an apple, an orange, and you select an orange. That's a positive event query. It also gives you some examples of strategic words. The textbook gives you examples of strategic words or phrases that are used with positive event queries. Read over those. They make sense for positive sort of questions and answers. All right, so positive event query, most students get that. That's the majority of the questions that you see. A negative event query is when the option is actually incorrect or incorrect with regard to the data that's presented. A lot of times it'll present situations where the nurse needs to intervene or follow up. It's used less frequently than those positive event queries. Make sure that you're reading questions carefully and rewording the questions. Common phrases used in negative event queries include terms like least likely, least priority, needs additional instructions is a huge one, indicates the need for follow-up, hasn't met outcome, requires the RN intervene, indicates the patient doesn't understand something, right? And with these types of negative event queries, I always suggest that students write the word wrong really big if they're taking a paper pencil test next to it. Because these types of questions would be like, which of the following is not true about an orange? And usually it's not going to be so blunt with the NCLEX style questions. It'll be who needs additional teaching. But our breakdown or our rewording of these should be what's wrong about teaching, these post-op instructions after a patient has a hip or whatever it is that the question is asking us. So a simplified example would be, which of the following is incorrect about an orange? And then your answer options are that it's round, it's flat, it's orange. And what happens is, so you read the question and okay, I get it. What's not right about an orange? And you start reading it and you get to something that really well is correct for it. So answer C was, it's the color orange. And you immediately think, yeah, for sure, it's orange. I know that for sure. And you select it. So these types of questions get students frequently because as they start looking at the answer options, they forget that they're trying to figure out what's incorrect or what's wrong, what needs an intervention, or what needs the RN to stop the nursing student from doing what they're doing. So if you get questions like this, my recommendation is that you actually write wrong really big next to your answer options so that as you're going through them, you're asking yourself, is this wrong or is this incorrect? And you sort of eliminate the things that are screaming, yes, that's correct, until you can narrow down and pick a correct answer that's whatever needs to be, whatever is incorrect, needs interventions or needs additional explanation. Our activity this week will actually have you identifying if practice questions are positive or negative event queries. So we're going to work through it. Again, it's a learning activity, so don't feel like you're going to have big issues if you're not quite sure yet. But we're looking for you to start identifying these negative event queries. So you sort of star them out, write a big wrong, or somehow let yourself know or remind yourself when you're taking a test that it's a negative event query. And we will again have a practice opportunity for that with our week 7 practice questions. So as we continue to look at different types of questions that we can see on the NCLEX, we're going to talk about these select N questions. Select N questions are different from select all that apply questions because they tell you exactly how many multiple response answers they want you to pick. So instead of saying select all that apply, it's going to say select your top 3 concerns, or select the top 4 lab values that you're going to follow up on. Something like that, where it's specifying exactly how many answer options it wants you to pick. For these types of questions where select all that apply are sort of partial credit on the NCLEX, select N are graded very similar to multiple choice questions. They're in essence an example of a multiple choice question, but sort of combined into one. So you get 1 point for correct answers and no points for incorrect answers. So here's an example of a select N NCLEX item type where you get a scenario and it says which 3 client assessment findings require immediate follow-up. So that specifying that you're going to pick 3 answers makes it a select N. No partial credit. This question would be worth 3 points. And for this question, in terms of test taking strategies, you're going to attack it the same way you do a multiple choice question, but instead of picking 1 correct answer, you're going to end up in this scenario with 3 correct answers. Another item type that you might see on the NCLEX or as you progress through nursing school is a multiple response grouping question. So options are presented in a table, and the table can have a minimum of 2 groupings and a maximum of 5, and then each grouping has 2 to 4 options. The test taker selects at least 1 option for each grouping, and this one is more of a partial credit, where you earn a point for correct information, lose a point for incorrect information, and minimum score you could get is 0. So this is an example of a multiple response grouping question where you get a scenario, then it's saying, you got to answer some things. Each body system will have more than one selection. Each category must have at least 1 thing selected. So it'll be at least 1, maybe more than 1, and you have to put it there. So it's just honestly very similar to a select all that apply question, right? Hence, it's graded the same way. The NCLEX grades it the same way as a select all that applies. But those you'd want to tackle the same way you would with a select all that apply. Sort of break it down. Each answer option, ask yourself, is this true or false? Does this apply yes or no? And go through and eliminate incorrect distractors and select your correct answers. That wraps it up for week 7. It's a pretty brief lecture for you. Your next recording will be over imposter syndrome.